Alam mo po ba na ang operasyon para sa tuhod kung ikaw ay may knee osteoarthritis ay on average nagkakahalaga ng 200,000 pesos each knee. Sa videong ito, malalaman mo if knee surgery is for you, possible na mga complications at realistic expectation after knee surgery. Magandang araw po, Doc Sherry po, Doctor of Physical Therapy, teaching you health tips and home exercise programs that you and your family can benefit from. Ang iyong tuhod ay made up sa lower part ng iyong thigh bone at upper part ng iyong shin bone plus your kneecap. And in between these bones, meron tayong tinatawag na cartilage. Ang function po ng ating cartilage is to prevent the bones from rubbing each other every time na ikaw ay gumagalaw. Pero sa case po ng knee osteoarthritis, aging plus being overweight, it can actually cause wear and tear sa ating cartilage. Kung kaya naman ang ating mga bones ay nagbubungguan, which is the root cause of our problem. Ang knee replacement or tinatawag natin na knee arthroplasty ay isang surgical procedure kung saan pinapalitan ang surface ng damaged bones caused by knee osteoarthritis. Pinapalitan ito ng metal or plastic para makap ang ating mga damaged na bone. Bagamat ang operasyon sa tuhod ay isang paraan para maigsan ang sakit na dulot ng knee osteoarthritis, ito po ay nagkakahalaga ng more or less 200,000 pesos per knee. Plus, kailangan din natin i-consider na kailangan pa nating mag-go through ng physical rehabilitation after surgery. Kailangan ito para ma-strengthen ang muscle sa operated na side, tuturuan ka kung paano ka lumakad again without jeopardizing your surgical site. Minsan, ang physical rehabilitation can be covered with your insurance at minsan naman hindi. Kaya mas mabuti na kausapin mo muna ang iyong insurance company para financially ready ka sa surgical procedure na ito. Usually, physical rehabilitation will be scheduled 3 times a week for 1 to 2 months depending sa rate ng iyong recovery. Is surgery for you? Sagutin mo ang mga katanungan na ito. Ano nga ba ang pain scale mo from 1 to 10, with 1 being minimal, 5 moderate, and 10 severe? If ang sagot mo ay between 9 and 10, then surgery may be likely. But consider these questions as well. Have you lost weight? Kailangan po natin ang weight management, either you have or have not gone through knee surgery. Because ang ating tuhod po, ito ay weight-bearing joint. Every pound na i-add mo sa iyong body weight, ito po ay katumbas ng 4 pounds additional pressure sa iyong tuhod. Have you consistently done your home exercise programs or ang mga knee exercises natin na makakatulong to conservatively manage knee pain caused by knee osteoarthritis? And have you done rehab? Personally, I would recommend knee surgery if your knee pain is severe enough and the stiffness is severe enough that it limits your daily activities. Plus, if you have tried all conservative management pero walang nag-workout at hindi ito mabisang nakadikis sa iyong symptoms, and if there is presence of bone deformity na nakakabother sa iyo. Wala po tayong age requirement para sa ating knee surgery. Ito ay based lamang talaga sa intensity ng iyong pain at your ability to do things independently. Before tayo magpatuloy sa possible complications as well as realistic expectations regarding knee surgery, I would really appreciate it po if you can click the like button below if may natutunan ka sa videong ito. Ito po ay makakatulong din sa channel na ito. Karamihan sa aking mga pasyente na nag-go through ng knee surgery would experience total or drastic improvement sa pain scale nila sa kanilang tuhod. Pero you cannot expect too much as well. Hindi mo po magagawa ang mga activities na hindi mo nagawa before you develop arthritis. At kailangan mong i-avoid ang high-impact activities such as jumping. Pero after knee replacement or knee surgery, Kaya mo pong mag-do ng unlimited walking, you can do low-impact sports, you can drive your car, you can do cycling as well. If nababahala ka sa possible complications ng knee surgery, incidence of complications are relatively low po. Possible complications would include infection, pero mabilis naman itong i-treat through antibiotics. One possible complication din is blood clots, but pwede din itong i-prevent ng physical therapy. And there are also rare instances wherein there is loose implants, wherein in this case, the joint needs to be replaced. Paano mo nga ba malalaman if you have severe form of knee osteoarthritis? Normal x-ray po plus your symptoms would already do. This is the normal x-ray of a normal knee. You will notice na uniform po ang space in between ng dalawang buto. This indicates healthy cartilage. Ito naman ang example ng ating x-ray na may osteoarthritis. Mapapansin mo na there is loss of joint space in between the two bones. This means that the cartilage is damaged. Although ang operasyon sa tuhod ay isang paraan para makatulong sa knee osteoarthritis, this shouldn't be your first option po. You try conservative management first, you try physical therapy. Ang isa mo pang option is corticosteroid injection. Pero ang iba ko mga pasyente, they would feel pain again after 3 to 4 months of injection. Or other options is topical pain relievers that can help you cope with the pain. I have here BEFREEZE. This is formulated po with Arnica montana extract, which had been shown in clinical trials to have the same effect as that of ibuprofen para masuit ang pain dulot ng arthritis without any side effects. If gusto mo itong i-try, I will put the link in the description box below. Pwede mo itong i-click. It will be delivered directly to your house because this is for shipping all over the Philippines. If by now ikaw ay committed to do your home exercises at hindi mo alam kung ano nga ba ang exercise na dapat angkop para sa knee osteoarthritis, meron akong video dito. Gawin mo ang mga exercise na ito minimum 3 to 4 times a week. Makakatulong talaga ito sa iyo. I hope na nakatulong ang video ito para mag-guide ka to determine if surgery is really for you. If you have reached the end of this video, please comment po stairs in the comment section below. I would really love to hear from you. Please share this video po to your friends at sa iyong mga family members para mas marami pa tayong tao na matulungan. Thank you very much for watching. This is again Cherry. Stay safe, stay happy and healthy. God bless you.